Welcome to the webinar on the India's lockdown. I'm Casey Kwok, Director of the Asia Global Fellows Program at the University of Hong Kong. This is the first of a series of webinars that we are putting together to provide a platform for our Asia Global Fellows around the world and the leadership of the Asia Global Institute to discuss and share views on important global policy issues. If you want to raise any question, please type in the chat box in your Facebook, and please share this webinar with your Facebook friends. Today, we will have Anand Krishnan, one of our 2019 Asia Global Fellows, to moderate and guide our discussions. I shall leave it to Anand to introduce other speakers and start the webinar. Anand, please.
Thank you so much, Casey, for that. A very good morning to all of you from Chennai here in South India. We are coming to you today from 4 different locations. I am Anand here in Chennai, where I work for a newspaper. I was also a 2019 Asia Global Fellow. We are joined by Dr. Amit Wanchu, who is in Srinagar in Jammu Kashmir, in the far north of India. So we are being very representative here. Amit is the perfect person to join us today. He is not only an entrepreneur and a social activist, but he's a doctor as well. So he's really the perfect speaker who can speak not only about the medical aspects of this public health crisis, but on the social impact and livelihood impact as well, which is a huge, huge problem for India. Amit was also a 2018 Asia Global Fellow. In Rajasthan, thank you, Amit. In Rajasthan, we have Akshay Mathur joining us. He's a former CEO of Gateway House, which is a premier Indian think tank. Akshay will share his thoughts with us on both the economic and geopolitical consequences for India from COVID-19. And Akshay was a 2017 Asia Global Fellow. And in Hong Kong, we have Heribert Dieter, who is the Director of Policy Research at the Asia Global Institute. Thank you all so much for joining us today. So we in India have been under lockdown since March 25th. We are expecting a phased and gradual exit from this lockdown by the start of next week. We will shortly assess the economic impact of how these past few weeks have been. But first, we should focus at the public health challenge. If I can come to you, Amit, first. As of today, April 27th, cases in India have crossed the 27,000 mark. We've had a 2,000 increase overnight. It took India only 4 days to go from 20,000 cases to 25,000 cases, and only China has more cases in the Asia Pacific. The Indian government has said that there is some reason for us to be optimistic that the doubling rate is decreasing. The health minister said yesterday there was some signs that perhaps there's a slowdown, if not a flattening of the curve. So Amit, just to brief us, what do you make of the trajectory of COVID-19 in India so far? Are we nearing a peak, or is it too soon to tell?
Thank you, Anand, and thank you, AGI, for organizing this webinar. Well, I would like to say that first and the foremost thing is that, in my opinion, May and June is going to be very crucial for us. As you rightly said, that in just 24 hours, we had 2,000 cases. So in last 10 days, the number of cases are increasing more. We also have to keep in mind that the testing, as we all have been talking about, the testing has not been that rapid, and we have not been able to cover that huge population, a country of 1.3 billion, and you know what are the problems in testing we are facing still now. Second, if we go just a bit in the past, we have to see that we had a first case in January, around last week of Jan, and India and China volume of travel is very less. And that is why I feel that the introduction of virus in January was still minimal. But once it reached out to US and Europe, and you see that we have a lot of travel volumes as far as US and Europe is concerned. And that's how in the month of March, from March onwards, we're seeing this rise. We also have to see then, as far as we see in our country, unfortunately, a stigma has been attached with this particular disease. And people are hiding their travel histories. They don't want to come in open because they feel that if there is any COVID-19 or coronavirus detected in them, or they are positive, they will be not welcomed in their home. They will not be welcomed in their own locality. And unfortunately, if they die, they will not even get the last rites properly in their particular area, as we have seen in different parts of our country, what has been happening. And we also have to keep in mind that India has been prone to epidemics. If you just see any data in last 2-3 years, 50% of the communicable diseases that we have in our country and people die are mostly either pneumonia or respiratory diseases. So considering that, it is a very, very problematic situation there. No doubt we put the lockdown, it was at the right time. Many measures have been taken because considering a country which is so diverse in culture, so diverse in languages, there are lots of challenges which we all can understand. But it is still, in my opinion, that May and June are going to be the most deciding factors, because I personally believe that now onwards in the month of May, you will have more and more patients. And as the testing will increase, because then only we can be, we'll be able to say that, yes, what is the percentage of patients. And we have to remember one very important thing, that lockdown is always about patients and not profits. You know, it is so important that we as a country have also come, like there have been ups, but there have been positive and downs as well to this. So I personally believe that right now it is the most important phase. And I at times even think that maybe 3rd May, they will not basically lift the lockdown fully, in, as you see in Delhi or in Maharashtra, what's happening. And one of the important populations that we have is the rural population. You know, India is more rural and less urban. And still the healthcare is very, very fragile there. And we have not been able to yet detect infections there. Most of the infections are either in urban areas or developed areas. And let us hope that it doesn't reach there, because then it's going to be a very, very difficult task.
Amit, before we get to the lockdown, you did mention the testing in India. The figures that we have suggest that India has the lowest testing rate for pretty much any country in Asia for sure. So Amit, how reliable are the numbers we are seeing? Is there a hidden wave of cases that we don't know about? And what's the situation affecting hospitals in India? Are they seeing a surge in patients, or is that not the case so far?
See, I'll tell you, as far as if we come to the data as such, I at times feel that we have inadequate data in the country. You know, the data source is only from the government. And we have this agency, what we call IDSP, which is Integrated Disease Surveillance Program. They are the ones which are collecting data either from the hospitals or from the labs. But if we see beyond that, there is no availability of data. And whatever peaks we are making or whatever people are just thinking, this is based on the data from Italy or China. That's how we are basically thinking that any person who has a case infects another one. And that's how we are basically making this ratio right now. So even the death register, you know, that we have so many inadequacies in that. Even at present, we don't know lots of deaths which are not registered, whether they were COVID deaths or non-COVID deaths. Like yesterday, we had a case of a pregnant woman in Jammu Kashmir who died. Initially, it was said she died just normally. There was nothing, but the sample was taken before she had to deliver babies. And now that test has come positive. So there are so many such things in that perspective where you cannot rely on this data. So I personally believe that there will be a lot of hidden cases, and the only way to do that is testing.
Akshay, one thing that we're seeing how COVID-19 is playing out in India is a huge variation across states. You're seeing states like Kerala that have a robust public health system taking steps right from the beginning. Where you used to live, Maharashtra, is perhaps on the other end of the spectrum, where signs are that there's uncontrolled clusters in many places. So can you shed some light to our audience why this is the case and how India's federal structure determines public health responses in different states?
Yeah, actually, I think going to first principles, it's really important to understand, and I take it that today we have a global audience for this webinar, that the health as a subject, as a responsibility, falls under the responsibility of the states in India by constitution. So all subjects in India, so at the central government is responsible for defense and foreign policy, and states are responsible for certain subjects like healthcare and law and order. So in India, health, the state governments are responsible for health. So that makes state government not only the front line to tackle this, but also we have to depend on the resources, the efficiency, the capacity, the competence of the states to really deal with this issue. Overall, many health experts and public policy experts for many years have said that we are spending way too low on health. I think it's close to 1% of GDP. And for many years, healthcare professionals have argued for more budgetary allocation for healthcare. Our common friend, Shamika Ravi, has written so much about how the healthcare system needs to be reformed, how the medical commission needs to be reformed, the medical regulator needs to be reformed. So there are many things which are now catching the government's attention, how there's reform that's required to deal with health as a responsibility of government. So it's a real test for something which the Indian government calls cooperative federalism. How can the center support the state in its effort? In some cases, the center does give financing support. I think the average is that the center would give, say, 25 to 30% of financing support, and the other 60 to 70% has to be borne by the states. But also coordination, the national level coordination is done by the state. So for instance, this vaccine, finding a new vaccine, that effort is happening at the center. So there are like 6 companies, as far as I understand at last count, which are now looking for a vaccine which the government has supported. And that is being spearheaded by the Department of Biotechnology at the center. So this kind of organization is really important, and that's why there's variation between states on how they approach this issue. The other thing that the center does is support the pharmaceutical industry. And I think a lot of people know that India is already known as the pharmacy of the world. We are the second or the third largest pharmaceutical producer. We're one of the largest producers of generic drugs in the world. But we are also very dependent on the inputs that come in, APIs as they're known, to produce those medicines in large numbers. So the pharmaceutical as an industry is supported by the center. But again, for the pharmaceutical industry and corporations to operate, they need support of the state governments, because you need land, you need electricity, and you need all the elements that any industry would need to operate. So I think this is going to be a real test for cooperative federalism, to see how we can approach this issue. And ultimately, in this program, if you also want to talk about migration and some of the other socioeconomic issues, I just want to mention at this point that not only is health a state government issue, but also social protection. All the protections that we offer to migrants is a state government issue. So from a public policy perspective, it's really important to understand who's at the front line and where the resources are coming from.
Heribert, if I can bring you in from your vantage point in Hong Kong. Now, the whole world has been looking at East Asia as the touchstone for responding effectively to COVID-19. So what have you made from your own perspective of how India has been responding, both as a national strategy as well as from an economic perspective as well?
Yeah, for me, it's let me inject a bit of skepticism into the debate. For me, it's quite surprising that India has chosen to put the country in a lockdown. Let me say why. As of last count, India had 28,000 cases. 880 people have died. For a large country like India, this is a very small, these are very small numbers. And for me, it has been puzzling why democratic India has chosen to implement a policy, the lockdown, that has been created by China in Wuhan in January. And India has followed that example rather than the South Korean or the Taiwanese example, who have managed the crisis quite well without putting people into a lockdown. And I think, if I may be a bit controversial, I think India cannot afford such a draconian policy for a longer period of time. I think already we see quite significant negative effects of the lockdown. So in my view, it's puzzling that the government has done that. Former Prime Minister Singh on the weekend has raised great concerns. He has suggested that he is very concerned about the future of Indian society, which is and I think Akshay made that point, which is also suffering from ethnical or religious kind of tension during that crisis. A final point at this juncture, if we look at the diseases that Indian society is confronted with and has been confronted with over the years, permit me to compare very briefly COVID-19 with tuberculosis. India is a hotspot for tuberculosis. Every year there have been 2.8 million new cases. About 435,000 people die every year of tuberculosis in India. So my humble question is, why have there never been such draconian measures to combat tuberculosis, and why do we see a very serious campaign against COVID-19, which comparatively, we don't know all that much about that disease yet, but which is comparatively less of a threat than tuberculosis. So a lot of puzzles remain from my vantage point of view here in Hong Kong.
Amit, can I get you to respond to that? Haribert makes the argument that perhaps a lockdown of this stringency has a lot of collateral costs for India, but on the flip side, the argument can be made that given our very limited public health resources, without a lockdown, our systems would have been overwhelmed. So how do you come in on this?
I think that you have to take one point into consideration, that when we know that our system is not working properly and is not ready to face this challenge, and you have not been introduced to this disease for a long time, there is not much research done by your medical professionals. They only are right now dependent on whatever is available either from Wuhan or from some few East Asian countries. So considering the diversity of the countries, different things matter at different places. So lockdown always was an easy thing for them to do, because at the end of the day, these crises also lead to a lot of political problems, and in case the government didn't want to take any risk, because they felt that if they take any risk and it backfires, so no one is going to save them that time. So lockdown was a very easy method compared to all other what Heribert was right now suggesting. And in my opinion, the major thing is that right now, very less is known about this disease, and no one wants to take a chance or a risk on his own head.
Akshay, your perspective on the lockdown and the economic challenges. Now, every government in the world is now wrestling with this debate. How far do you keep locking down? How do you open up? How do you exit? How do you measure the collateral costs, not just economic collateral costs, but a spike in non-COVID deaths? As Amit said, there's stigmas involved as well. People are refusing to seek treatment. So now that we're looking at next week as a possible start of moving on to the next phase, what do you think the Indian government's outlook is, especially when it comes to the economy and the most pressing economic challenges, Akshay?
So, our government has done what it has always known to do, what they're trained to do, not just our government, but all economic professionals and officials all over the world, which is, we have the central bank, number one. They have introduced some liquidity. They have used cash reserve ratio. They have changed the reverse repo rate. They have rescheduled term loans. They have put a moratorium on what can be classified as a non-performing asset so that the ratings don't change. The support for non-banking financial companies. So the central bank is doing what it can do. There is the central government, which is taking a fiscal approach, introduced $20 billion worth of effort. And they're trying to help the state governments pass on some of these, some of the finances which are held up with the central government. I think then there is also the states, and again, let me come back to it, that one of the really important things that the state government is responsible for are the agriculture mandis, or in English as we call them, agriculture marketplaces. That's where the farmers go to actually sell their produce. That comes under the state government. And there is lots of reports that, we have maybe only say 60 to 70% of the mandis operational in the country today. And for the global audience, the last harvest has just happened in the last 2 to 3 weeks. So all the farmers are desperate to sell their produce into the market, into those marketplaces. So the state government really needs to ensure that that's open. So that to keep the economy going. Keep in mind that this so far has been a problem for the urban poor. This lockdown has affected the urban poor the most because there are no jobs. So those who don't have access to government resources have not had food, and those who are on daily wages have not been able to get access to what they need. But this can soon become a rural poor problem if the harvest is not bought up by the government, if the government does not procure, they cannot sell. So it's really important that, that those marketplaces remain open. And this is also applies to some of the neighborhood stores. 2 days ago, the government has now opened up the neighborhood stores. So Heribert, even though the country is under lockdown, but the first decision to open has been the neighborhood stores, the standalone stores, to get that kind of economy going. Also for the bottom of the pyramid, I see that in most forums, two questions always come up, Anand, which is, how do we take care of food for those who are absolutely at the bottom of the pyramid, and what do we do for the migrants? I think the data shows so far that there is enough food. Actually, there's 3 times the amount of food than that is required to actually distribute. So we have a lot of food. Also for migrants, some of the labor funds that we have in the country have enough that they can distribute to the migrants, especially those who are in need. Challenge lies with the implementation. And how do we make sure that the right people get it? And there is so much variation in this country where we have energetic leaders, state leaders, good government officials, we're being able to deliver. And so whether it's a monetary policy from the central bank government, the transmission effects of whether it's a monetary policy or fiscal policy, or if it has got to do with procurement of foods or distribution, all boils down to where we have good officials and we have good systems in place to do that.
Amit, if I can bring you in, one issue that has really come to the fore is the migrant issue. It's been covered extensively in the media as well. And really, many states haven't come up with an effective response to deal with this problem of so many of their own citizens who've been stranded outside and finding it very difficult to come back home. So from your own perspective, now that we've been fairly deep inside the lockdown, has India handled this poorly, the issue of fending for migrants who've been stuck in cities?
I would say in the initial phase, yes, because if you remember that we were given only 4 hours that at 8 p.m. Prime Minister announced that lockdown will be in effect from 12 midnight. And all these migrant laborers, in fact, even people from middle class, no one had an idea. And you saw that day that what happened, people went to markets to purchase, there was panic buying, so many things happened. So for these migrant laborers, we have to understand that for them, social security is more important than economic security. And that social security they get in their own villages, in their own small towns, because they come to all these urban areas just to make their earning, just to earn money. Even their families fully are either with them for some particular time or are not there. And then many of them are also associated with the agriculture in their own villages. They go during the harvest time and try to help their families there as well. So as far as the migrant laborers issue is concerned, the first major challenge that we got, if you remember, just after a few days, there was in that railway station in Delhi, people all thronged that, and there was no way that they could just stop them. But yes, after 2-3 days, the step that I appreciate taking is both like government as well as NGOs came together. What I can tell you that migrant issue also got us as a country together, I think for the first time after any war. If you go today, you see any SOS, you go to any state, you go to any place, people even in their individual capacities as NGOs and as governments, the basic target is providing food to needy. And we should complement some state governments as well. Like in Delhi, we had so many community kitchens. As we know that we have those Anganwadi workers. For the global audience, these are the workers who deal with the children and provide them midday meal. And they have these huge kitchens, which were basically utilized for all these laborers. And also they were provided in places like stadiums, places where you had big community halls. And for them, if they get food and they get a proper place to live, that was a very important issue, because how can you expect them living in 4x6 or 6x8 feet rooms to have self-isolation? What physical distancing they will follow? They don't have a running tap water. So how are they going to wash? The same water will be used by so many people. Sanitizers, forget, they don't have even soap, forget about sanitizers. So this issue definitely in the initial phase was not handled at all in a proper way. And then there was a backlash, because as we were talking, that people from different countries were got back to India, like all the non-resident Indian or students. And there was a backlash from the society that when you could get rich by sending aeroplanes, why didn't get poor? Because we know that so many poor also died on way to their homes. They were walking all the way, like miles and miles together, even with their kids, because they did not find themselves secure in all these big towns. So one of the major issues was that. But yes, after facing this crisis, people came together, both government, NGO, like, you know that every 10th or 15th, within a week, like every NGO has to send their data, what and in which area they are operating, so that the doubling is stopped. And that has helped a lot. Like now one particular NGO is working in one particular area, providing one particular commodity, and that has really helped a lot in facing this crisis. And now we are listening that by 3rd May or so, many people will be brought back to their places with restricted transport service, whether it's in Uttar Pradesh or in Bihar or in Madhya Pradesh. So I think, yes, it had initially was a crisis, but now slowly we have managed. Like it's a journey, you know, lockdown is also a journey. It was an inward journey first, and now we have identified the outward journey.
So if you are watching on Facebook, please send us your questions. We are already getting a lot of questions. Before I come to you guys, one question for Heribert. Now that we are looking at the exit of the lockdown, what would you advise the Indian government's priorities to be? A phased lockdown according to states and how they're dealing with it, or are you more in favor of a very strong focus on the economy?
Well, I'm not in a position to give advice to the Indian government. There are thousands of people that know the situation much better than I do. But as you have seen in my first intervention, I'm skeptical of the benefits of the lockdown, and at the same time, I'm aware of the economic collateral damage that is done. One additional point on the damage: we know that apart from tuberculosis, I already mentioned that. India, in particular the northeast, the state of Odisha, has a serious malaria problem. Now, at the moment, because of the lockdown, all the fight against malaria is somehow restricted, because the health workers can't go out and provide the necessary measures and instruments, including mosquito nets, to the villages. So these are negative effects of the lockdown that should be considered. My personal take would be open up as soon as possible. One thing that should not be forgotten: India is in competition in global value chains with other economies, namely with China. Akshay mentioned APIs, active pharmaceutical ingredients. India used to be #1. India has been replaced. The #1 spot is now taken by China. And China is very actively pushing to re-establish its position as a major provider of inputs to other economies. If India stays in a lockdown for too long, it will fall back. It, rather than use this opportunity to establish itself as a provider of inputs for other economies, it will fall back. And some Indian economists, namely your former central bank governor Subbarayu, has suggested that India may have a problem in financial markets relatively soon. Will financial markets tolerate a budget deficit of India of 10% of GDP? I know this sounds brutal at a time when people are suffering and some people are passing away, but sooner or later this question has to be put on the table again. How much money can India spend on fighting this particular crisis?
Well, thank you for that, Heribert. I think we have a question now from Nima Shering, who's joining us from Bhutan. Nima, would you like to pose your question? Please go ahead. Graham, can you unmute Nima, please?
Thank you, Anand. Thank you for this wonderful discussion. Before I ask my question, first of all, in solidarity with India, both in India's leadership within and also establishment of SAARC Emergency COVID Fund within the SAARC region with the Prime Minister Modi's leadership. It also helped the region, so it's quite, I want to acknowledge on that. But having said that, with 1.3 billion population, challenge is very huge. So I would like to bounce off Professor Dieter's question that is lockdown doing more harm than good for India? And for that is for two reasons. One, I think you already have touched that India structure, when you look at the structure of India's economy, about 80 to 90% of the total workforce from the people's perspective is in the informal economy rather than in the formal economy. On the other side, when you look at India's demographic, India is a young country with a huge young population. Median age for India right now is 28 compared to 28 years compared to India 38 years or Germany 48 years. And even from 40 years from now, one data prediction shows that in 2060, India's median age of the population will still be 32 years compared to Germany's 52 or China's 49. So both from the economic opportunity of demographic dividend on one hand, and the huge population of people in the informal worker with no social protection, no other like, the challenge of, as Akshay mentioned, challenge of delivery service because they are not recorded, they are not in the data system. So when you look both from these two perspectives, of course, like I'm not discounting, health is very important. There's no price tag to even one life lost. But India is a very, like between the two difficult decision, both right. May be a right decision. It's easy when there's one wrong decision and one bad or good decision. But it is so hard from the leadership perspective when you have two right decisions. And in this case, I would like to address the question on how is India thinking from the unemployment perspective. India already had a huge unemployment before COVID-19, right. And now as you can see it's escalating. And taking into consideration these two factors, India is a young population, demographic dividend, 28 years now, 32 years, median age, 40 years from now. It's different from many countries around the world. And I read that 140 million going out of the job is huge. It's right. Almost the size of whole of Germany and whole of Italy. So that's my question, how India is addressing that.
So unemployment, we'll take a couple of more questions before I pose it to our panelists. I think we have a question from Kailash Iyer. Please go ahead.
Hi, my name is Kailash and I'm calling in from Nairobi, though I'm from India. The invite for this chat said that one of the things it said was, what can NGOs do to support the underprivileged whilst grappling with its own financial problems? I don't think we did justice to that part of the conversation. I would encourage the panelists to talk more about it. And my question is also related to that. It might sound slightly insignificant compared to the whole Indian economy, but social enterprises nowadays do play a significant part in economic development, especially for the underprivileged. And some of the key issues that social enterprises face is, they are offering these alternate to the traditional grant models, and surely their business models are going to suffer tremendously due to this lockdown and probably the economic crisis that might come subsequent to this lockdown. Social enterprises, be it in agriculture or micro right. enterprises, yeah. Or skill development or whatever, is also they also have a high touch model, as in they don't have these fancy apps and all. They have a very personal sort of a relationship with people who are engaged with them, both in the upstream and the downstream. Right. And finally, it's also a very nascent subsector, and they're already faced with tremendous problems like capital formation, and it's a very fragile business model, and access to finance is an issue. They work with very low income people. So, even minimal profits they're making will be wiped out in the coming one or a few months.
Okay. Well,
so my question
is, for that, I think it's on social enterprises. So maybe Amit, can you weigh in on these two questions? One is on the unemployment aspect, and the second is Kailash's question. Amit?
See, I definitely agree that it's going to be a huge challenge in both the sectors. As far as the NGOs are concerned, we are seeing that even right now, like whatever is possible, this is right now working on the basis of pooling of resources between NGOs. There are also places in different states in India wherein government and NGOs are pooling in resources, because everyone knows that this is a long battle. And since the businesses are already down and people are not going to have that percentage of expenses that they would spend on CSRs initially after post-COVID. So the problem is for NGOs that how to right now sustain. That's why when I was addressing that right now, most of the NGOs, even those who are working with children or adults or old age people or general women-oriented NGOs, everyone is right now focusing on survival. Because right now you cannot plan for something what will happen after 3 years. Right now everyone is planning what is the strategy for coming 3 months or coming 6 months, because that is how they are adjusting their budgets. And major part of that budget is going into the food oriented programs or survival oriented programs for all those people who are suffering right now. As far as the social enterprises concerned, we have Invest India Forum, which was started by government, wherein all the people have been encouraged to come up with the models in which can be workable. Like people are working on ventilators, people are working on the splitters that can be made so that one ventilator can work for many people. People are working on various other technicalities in different parts of India, and anyone who will come up with a very good project is getting support from the government. As far as the unemployment is concerned, I personally believe also one aspect, if you will see that the Modi government before COVID was being attacked only on one front, and that was economics. As you know that we were not doing economically well, and that was one of the major things that opposition was pulling on this government. But after COVID crisis, I think it has happened in a way better for the government, because now they are sailing in the same boat as others are, and they feel that this has given them a space to invest in things. Like they are comparing right now India and China. Like in this COVID crisis also, they are looking for opportunities, as Herbert was saying, that somehow people in the rest of the world don't want to keep all the eggs in one basket that's in China. So they are also looking for alternate places wherein they would like to invest and do things. So government, as I was checking with some policymakers, they are looking at two options. One is to have the retirement age lowered so that you have huge central government employees and even employees which are working in class 3, class 4 levels, wherein the number is more, and post-COVID you have to have social distancing. So you may have this number decreased and the opportunities, job opportunities in government sector increased, number one. And number second, the salary structure will be reduced so that you are able to have and accommodate more youngsters at a lesser salary, and these will be contractual jobs compared to what initially you used to have permanent jobs. So everyone is working. The situation is obviously very tough, but in this crisis, India is also looking at an opportunity, which compared to China, it may be able to leverage in a better way.
Thanks, Amit. On the topic of China, we have a couple of questions coming in, so I think I will pose them right now. For Heribert, we have a question from Ashok Kanta, who is the former Indian ambassador in China, of course. He says, if the lockdown is not the answer, what should the government of India do? The lockdown might have originated in Wuhan, but it's now the new normal everywhere in the US, Europe, elsewhere. So that's a question for Heribert. We also have a question from Alejandro Reyes, who is the Director of Knowledge Dissemination at the Asia Global Institute. Al's question, which I'll pose to Akshay, is what is the general attitude of the Indian public towards China? Is there some animus against China, the Chinese leadership, because of the coronavirus? Or has China's coronavirus diplomacy been well received in India? So Heribert, if you could wait.
Thank you for speaking for me, Anand.
Heribert, go ahead.
Yeah, thank you very much, Ambassador Kanta, for your question. And I totally agree. Many, not all, many governments around the world have embraced that lockdown policy. What surprises me is that the non-lockdown countries are not studied as intensely as the lockdown countries. And what I cannot see is that those countries with severe lockdowns, take Spain, for instance, are performing better than the countries without a lockdown. I think one of the puzzles that remains is, do we aim to live with a virus or do we want to eliminate the virus? Just in one sentence, the government of Hong Kong doesn't have an answer to that question. It wants to keep the virus out of Hong Kong, which means nobody can travel to Hong Kong, no business person can travel to Hong Kong. Asia's global city will cease to exist if that policy is not reversed in the short to medium term. And for India, I think one thing we should consider, and Nima in his intervention raised that point, India is a very young country. Indian citizens are much younger on average than citizens elsewhere. Now, if we look at who is suffering from that virus, and if we look at Italy, for instance, 99% of the victims of COVID-19 in Italy were over 80 years of age. This is sharply different from the Spanish flu, which attacked both middle-aged people and old people. This one is primarily dangerous for old people. So the question is it fair to India's young people to make them pay for the protection of a rather small proportion of Indian society? Is it appropriate that their prospects for a future are severely negatively affected with such a draconian measure? It's of course not my business to decide whether it's right or wrong, but Ambassador Kanta asked the question what the alternatives would be. And here I point again to Taiwan, South Korea and Hong Kong. I think there are measures that can be taken that are quite effective in addressing the danger. For instance, wearing a face mask seems to be a rather good and cheap. It used to be cheap, now they are of course very expensive, but a face mask is comparatively cheap compared to a lockdown. And remember, in Hong Kong, for the time until today, 4 people died of that virus, which is a relatively good outcome compared to other potential outcomes. So face masks, social distancing are alternatives to a lockdown, and the sooner India goes back to that, the smaller the negative economic effects will be, and the brighter the future for India's young people will be.
Well, thank you, Haribert, for that. Akshay, before you come to Al's question on the public attitudes towards China, we have another question from Sila Ing, which is in a related question on the geopolitical aspects for India. How is India weighing the opportunities offered as a major exporter of drugs? We know India has been offering the controversial HCQ to some countries as well. How does it balance this with its own domestic pharmaceutical needs? Akshay, if you could weigh in on both those questions.
Yeah. Can you hear me well? I just logged back in. So
yes, you're fine. Yeah.
So Anant, geopolitics and geoeconomics, my favorite subject. So thanks for giving me that opportunity. If you look at the last 1 month, Prime Minister's just analyzed the set of meetings he's had. Just in the last 1 month, he's had approximately 30 meetings, phone calls, obviously, but he's had 30 one-on-one meetings with 30 different world leaders, right? So he was part of 2 multilateral meetings, the G20 and the SARC meeting, which he initiated. Apparently the G20 was also his idea. But he's had one-on-one meetings with 12 to 14 of bilateral meetings with G20 leaders. He's spoken to 5 of the Gulf country leaders. He has spoken to the chair of the African Union, the chair of ASEAN, Vietnam. For those interested in geopolitics, he's spoken to all the Quad nations, the leaders of all the Quad nations, the chair of Organization for Islamic Country, which is Saudi Arabia, which is also the chair of G20 this year, spoken to UAE, which is the chair of the Gulf Cooperation Council. All of it indicating that he himself is using and leveraging this along with the foreign minister as a real opportunity to present India and India's credentials for global governance. Being an actor, India's role and India's place in the world and has long been questioned, and we don't have the economic heft to lead the global economic agenda. But in some cases we might have. So this has clearly indicated that we have something to deliver and lead. I'm not a government spokesman. I know that there are all kinds of issues and the promises that are being made. We have promised to about 50 countries, we have promised hydroxychloroquine. and we don't even know if that works, but since the countries have asked for that, we lifted the export restrictions so that we could let countries have these medicines. We have been really good in evacuating our citizens from different countries. So this has been a very, very good moment for the Indian Foreign Ministry. If there is ever a line to believe in where never let a good crisis go to waste, they have certainly not let it happen. I do think that there is also an expectation that if India can help with the pharmaceutical needs, and we are trying to develop our own vaccine, but tomorrow if a vaccine is developed, say in France or in Germany or in the United States, then hopefully we will get access to that vaccine. And so I think the India's positioning has been fantastic. I also want to mention that I thought I saw a hint, but there's also a chance here, not just for taking the supply chains away from China, but you've seen the investment by Facebook into Reliance, the $5.5 billion investment for a 10% stake. That's huge because, as a country, we're coming close to having 1 billion people on the internet. So obviously digital economy is one thing that's going to pick up. So I think there's a bit of a give, and I think India has positioned itself really well so far.
And Akshay, could you weigh in on Al's question on the public sentiments in India towards China and the Chinese leadership? What's your sense of how that's playing out? And is this Chinese coronavirus diplomacy, is a phrase Al used, is that any chance of succeeding in India, or is there huge skepticism in India about China right now?
So let me put it in this context. There is skepticism, obviously. A lot of people usually miss the fact that for the most part in India, Indian business and even Indian society used to use China as a good benchmark. Because whereas the West was not an appropriate model and China has 1 billion population, so it was easy to say, look, they also have 1 billion population. If they can get the infrastructure right, so can we. Why can't we get our manufacturing right? So for a long time, China has been held as a good benchmark for manufacturing and for infrastructure. As far as this is concerned, one of the things that more and more, in terms of the society, is becoming more skeptical is the data that is coming out. It's getting hard and hard to believe that it's only 80,000 cases where the best countries in the world have not been able to manage the crisis. So I don't think the Chinese information campaign is working as is being prescribed. And there are a lot of people in the think tank circuit as well as journalists who are talking about it every day in the news. So there is certainly a wider understanding of China than there used to be.
We have a question from Casey Kwok, who is the program director of the Asia Global Fellows Program at the Asia Global Institute. And I'll pose this to Akshay again. Casey wants to know, what role has the business sector in India played in addressing the COVID-19 challenge? And is there more that they could do?
So initially what happened was there was the business and the business leadership was quiet. They were doing some homework of their own to figure out how their supply chains are affected, when can they start their industries again. And remember, the businesses are really focused in making sure what happens to their own inventory, what happens to the workers that are in their factories and their industries, their employees and their salaries, and how do we manage layoffs and how do we honor job offers that have been given. So they've had some serious issues internally that they've had to focus on. But as far as the medical this thing is concerned, it took the industry a little while to warm up to the idea, especially because they got prompted by the civil society and the society, by the social media into doing things. But when Jack Ma from Alibaba and Bill Gates started giving huge donations. And after that, the Indian industry really picked up. And some of the industrialists you can see, and they're using the opportunity to build ventilators. They're using the opportunity to provide PPEs. They're using the opportunity to help migrants. They're also using the opportunity to tie up with the West. All the pharmaceutical industry, the Serum Institute of India, as you know, has partnered with that's preparing a vaccine, has partnered with an institution in the West. So it took them a while to get up to speed, but I think they are now responding. And some of the forward-looking industry leaders have always said, just as they said for climate change, that we need to reconfigure our business model so that we can make sustainability a profit-making exercise Mr. Mahindra has said that. The Tatas have said that. So I hope that they will continue.
Thank you, Akshay. We have a couple of questions for Amit. A question from Hussein Reka, who is a 2019 Asia Global Fellow. He says, Kashmir has been on lockdown since last year, more or less. So how is the population in Kashmir coping with this prolonged period, first from the state-imposed lockdown, now from the COVID lockdown, in dealing with economic issues, social issues? How are people in Kashmir coping? Two other questions for you, Amit, maybe you could take them together. A question from Beam Suba in Sikkim. He says, apart from the lockdown, what are the other measures that the government should be taking in terms of checking the spread of the virus? A similar question from Nigeria, from Charity Amayembo, a 2019 Asia Global Fellow. He says, what are the strategies India is adopting in checking the community spread of the virus? So if you could, first the situation in Kashmir and the health measures. Amit.
Well, Kashmir, I will say that lockdown is a way of life for us here now. It's almost 1 year, and not only 1 year, even in the last 2 to 3 decades, we have seen successful lockdowns. And I would like to say that the principle, if I had to put in one line for us in lockdown, is that you have to live in present and plan for future. That's how we have been working here. And in that, the most important thing is a strong community role, because until unless the communities don't work, it all is about sharing. And that is how Kashmir has worked, whether it has been in terms of private sector and then also the planning. Like I will tell you that even in lockdowns, we have maximum shopping malls don't work in lockdowns. Your neighborhood stores work in lockdowns. You have people who have put their stores in homes, in houses. And now coming to COVID also, like they sanitize you before that and you go into their homes, take up the things and come back. And then there is a community participation wherein if in a particular community, you are able to identify 20% people who cannot afford, rest of the people, they share their resources for them. And because of lockdown, we have always purchased and kept stores in a big number in our particular localities. And that is how we have lived this. So you have to live in present, you have a strong community role, which should be there. And that will help you in sustaining and surviving things. And the most important thing is that you have to face the challenge of mental health in your society. So please don't get yourself stressed in these situations. It's very important that I would say that you should sleep nicely and you should dream as much as possible, because these are long battles. This is not something going to end tomorrow. So we all have to be prepared for that. Coming to the second question that I forgot, what was the Nigerian question?
On the community spread in India, what are the measures? And if you could also speak about to Beam Suba's question on the measures besides the lockdown.
See, measures besides the lockdown, as Herbert was also saying, that we all have to take precautions in our societies, which is first usage of masks, because that's one of the most important things. And we have to make it possible for almost everyone that they should be able to have masks, because we have huge population which cannot even afford that. Number second is the basic hygiene things, whether it is sanitizing, because it is all as far as the community is concerned, we have to take care of such a huge population. Number third is the healthcare and hospital infrastructure. You know that even we have doctors who have faced stigma. We have lack of manpower. We need manpower who can basically control that. Then we also have to have a strategy wherein senior doctors are not to be kept as frontline workers, because that is going to be a risk factor. They should always be there as a strategy making people, and young doctors have to be in the front line. Then we also have to have a good protective equipment, because we have paucity of protective equipment as well, which has to be provided. Another important thing is the stigma, as you were talking about the Chinese thing. Even we had people from Northeast who were attacked in so many places in the country just because their face resembles a Chinese face. So until unless you are not able to fight that stigma, for that you have to have a very good communication strategy, wherein people should know what this disease is. This disease is curable. We have to go on that thing that in India, it's around 3.3% that you have a fatality rate still. So 96 to 97% people can survive. This is something which we have not been able to project nicely. The only thing that we have been able to project is that this disease is going to kill you. This disease is going to kill your family. So that's one of the most important factors. And as far as hospital infrastructure is concerned, you know that mostly COVID-19 things are being taken care of by government hospitals, not by the private hospitals, because one, the paramedics there and the nurses, they are on contract. So until and unless government announces a measure wherein those people should also be covered under the health insurance things, and they should also have an earning, because they don't want to join duties because of the risk and since they are on contract. Second is, as far as the government hospitals are concerned, trust factor is very less. You know that even in major cities, we would like to go to a private hospital and bypass public hospital. And the third problem is that you have to take care of non-COVID emergencies as well. Because what is happening is that people are moving out of their homes, either for a chemotherapy patient, for a dialysis patient, for a patient who has been operated, for pregnancy patients. And these things are to be channelized so that you have COVID hospitals and you have non-COVID hospitals. These all things together are going to help you both in decreasing the transmission things and also having the measures in place so that until and unless your health worker doesn't feel safe, your own people don't feel safe in coming out, even if you lift lockdown, people will not come out. So we have to get that fear psychosis out and give them that sense that they all are safe, and we are taking measures for that.
Well, thank you so much for that, Amit. And I would recommend, if you're interested in learning more about Kashmir's situation in the lockdown, Amit has just published an excellent piece on the AGI Global Online website. So I would recommend all of you check that out. I think we're running out of time. One last question to wrap this discussion up, which I would pose to all three of you, starting with Heribert. This is from Julian Leong in Hong Kong. Can the Chinese experience be a frame of reference for the Indian government to tackle the crisis? If you could weigh in on both the lessons from China as well as perhaps things that we shouldn't learn from China. Heribert?
I think India should not take the Chinese example as a blueprint for their own situation. I think it would be better if India would develop its tailor-made approach. And in contrast to China, India is a democracy which puts a lot of emphasis on the protection of the individual rights of citizens. They have been negatively affected in the last 4 weeks of the lockdown, and India should in that regard return to a normal life as soon as possible, which is of course not risk-free.
And Akshay, if you want to weigh in on that, if I could just broaden that beyond China, given India's specific challenges, its political system, its federal structure that you mentioned, do other lessons apply as well, whether it's Singapore or Taiwan or South Korea, Akshay?
Probably that if we really believe in a market economy and we really believe in startups, which we take so much pride in, and if we really believe in our industry and our talent, which we know with this country of engineers and doctors, we really have to take a decentralized approach to innovation. We have to find a way in which we can let that kind of innovation bubble up. The government has already announced the Health and Family Welfare website has a portal in which researchers can come together and propose various ways in which they can address the crisis, including vaccination or other kinds of things that they've developed. There's, so in that sense, we cannot take the Chinese example. We have to take a more decentralized approach. And we do have a certain section of the population at the bottom of the pyramid. And so a decentralized approach as far as innovation is concerned, a decentralized approach as far as distributing rations and food grains is concerned, a more distributed and decentralized model as far as making sure that the small and medium enterprises and neighborhood stores are supported. So I think in all of those things, I think that we cannot take the China example, except for one thing. Those cases which are containment zones, where we need to quickly develop or construct maybe hospitals or containment zones, or there I think we should not be shy in admitting that we don't have the same kind of engineering skills. We have taken on private hospitals and converted them, but we should not be shy in admitting that's one area which we still need to improve on.
Amit, I will leave the last word for you, as well as the difficult task of summing up. You did mention that May and June are going to be the most crucial phase for India in this COVID-19 battle. So looking into the crystal ball, Amit, what do you expect the next 2 months to hold for us here in India?
So I think that as far as learning from China is concerned, on that question, I would say that the lockdown we have already followed, because China is the one which introduced that lockdown first. But if we have to learn from a country, I would say we should learn from Vietnam. The way they have handled the things, the way even there has not been that much of testing in Vietnam. And considering even the investment part, you know, so many companies are investing in Vietnam as well. So I would like that we should take some learning from Vietnam in that perspective. As far as the next 2 months are concerned, I hope that something best occurs, but as of now, I feel that we are going to have very, very crucial time. In coming 10 to 15 days, you will have number of cases rising. And by the May end, I think it will be more as the testing also grows as we are able to cover more and more zones. But yes, equally, we have to see as Kerala is somehow behaving normal or the other zones which are behaving normal, we have to see some kind of opening also in those areas so that you're able to balance. And most important thing, which I think now is very important, is zonal participation. Say, for example, we have North Zone. So Jammu Kashmir, Himachal, Haryana, Rajasthan, Delhi, Punjab, they have to together pool in the resources. Say, for example, we have apples can be sold into these 5 regions. Punjab has the crop, we can buy these things, say in J&K or Himachal. Similarly, Himachal has one particular thing, because one, you are minimizing the transportation, you are minimizing the resource, workforce, and by all these zonal things, you can basically pull this fight together and have open zones as well as red or closed zones.
Thank you, Amit, for that. And thank you, all of you, Amit Wanshu, Akshay Mathur, Haribert Dieter. It's been a really fascinating discussion. Thank you for joining us today. It's going to be a very long road ahead, not just for India, but for the rest of us as well. So we can only hope for the best. There is some reason to be optimistic, as Amit reminded us of Kerala as one model that we hope the rest of India will follow. If you found this interesting, please do closely follow the AGI Global Institute on Facebook, on Twitter, on LinkedIn. We plan to have more such discussions. Thank you all for joining us today. Have a good day and stay safe.